friends, today I am going to talk about complications of IVF. So you have heard about success rate, procedure, steps, everything. Now you want to know about the complications. It is very essential to know. So one most important complication is ovarian hyperstimulation syndrome, OHSS. It is a very dreaded complication and every clinic tries to avoid this complication. So it happens to people who have a lot of follicles or polycystic ovarian syndrome, people who have PCOD or PCOS, whatever, they have a very high chance of hyper responding to the injections. So the injection which we use for IVF, so the motive is simple, you want to stimulate the ovary. So what happens with people with good ovarian reserve is that they hyper stimulate, they hyper respond to the injections. So there is too much follicles, too much follicle formation, too many eggs. So what happens is that when you put this HCG injection, the ovary hyper response produces too much fluid in the abdomen. So there is fluid collection in the abdomen, sometimes in the lungs also. So this is a very bad complication of IVF. So how to avoid this complication? It's very simple. Just freeze the embryo, don't do transfer, or go for an agonist triggering. Instead of HCG injection, use agonist injection. So there is absolutely no chance of OHSS. So we follow this protocol. The next important complication is multiple pregnancy. Since you are going to transfer 2 or 3 embryos, there is a very high chance of twins or triplet. So we all know the risks of having twin or triplet. There is a chance of having a preterm delivery. So this is one more complication. The next other complication is ectopic pregnancy. So when we transfer 2 or 3 embryos or single embryo, whatever, there is a chance that this embryo can go to the fallopian tube and can get implanted there and the pregnancy can continue there. So this is there is a high risk of ectopic pregnancy in IVF. If there is a chance of, suppose the ectopic formation in natural pregnancy is 1 in 1000, here it is 10 in 1000. So it is 10 times more increase. Because we transfer more embryos, there is a chance of embryos going into the tubes. So how to avoid this? Go for a blastocyst transfer. The chance of ectopic is very much reduced. So next important complication of IVF, that is during the process of egg pickup, when we pass the needle into the ovary, there is a chance that this needle may go and damage the adjacent structures. So you may have bleeding which may need surgical intervention, or you may damage the urinary bladder, so you will have some bleeding which can be again managed conservatively. This is one important complication, but it very rarely happens. So 1 in 10,000, 1 in 5,000. So this risk you can definitely avoid. And next important problem with IVF is miscarriage. So some studies have shown that the miscarriage rate with IVF is much higher than a natural pregnancy, but you can avoid this risk by using extra medications like progesterone, aspirin, heparin. So this reduces the risk of miscarriage. So these are the complications of IVF. Thank you very much for watching this video. I hope you don't have any of these complications during your IVF cycle. Thank you for watching this video. In case you have any questions, you can comment in this video, or you can send an email at aishwarya.in@gmail.com, or you can contact us through our website, which is aishwaryafertility.com, which is mentioned in the video. Thank you.